Welcome to the Spark Conversations podcast. Bienvenue au balado Spark Conversation. Brought to you in a mini-series format, enabling deeper dives on issues that matter to children's healthcare systems. Through the ripple effects created through podcast conversations, knowledge sharing, collective action, and advocacy, Children's Healthcare Canada aims to advance innovative, accessible, equitable, integrated, and purpose-built systems of care for children, youth, and their families. I'll begin by acknowledging that Children's Healthcare Canada operates on the traditional and unceded territory of the Algonquin and Anishinaabe peoples. We recognize and deeply appreciate their historic connection to Ottawa. Today, Ottawa is home to Indigenous peoples from across Turtle Island. Children's Healthcare Canada is committed to forging new and deepening existing relationships with First Nations, Inuit, and Métis peoples. Children's Healthcare Canada would like to thank the IWK Health Centre for their generous support of the Spark Conversations podcast series. We are grateful to Child Bright for their generous support of this episode. It enables us to share these important conversations to inform children's healthcare system improvement. The Child Bright Network is a pan-Canadian research network dedicated to improving the lives of children and youth with brain-based developmental disabilities and their families, bringing together researchers, clinicians, policymakers, and people with lived experience. Child Bright advances patient-oriented research, knowledge sharing, and innovative care to help create brighter futures for children and youth with disabilities across Canada. Enjoy the podcast! Bonne écoute!
I'm Paula Robeson, and it's my pleasure to introduce this mini-series, Childhood Disability and Healthcare System Improvement. I'm delighted today to introduce the third episode in this mini-series, The Long View, Building Lifetime Pathways for Children of All Abilities. I'd also like to welcome Keiko Shikako, who will be moderating the conversations for this series. Keiko is a Canada Research Chair in Childhood Disabilities, Participation and Knowledge Translation, and an Associate Professor in the School of Physical and Occupational Therapy at McGill University. Before I pass the mic to Keiko, I'd like to introduce her guests for this episode. Stephanie Glegg is Assistant Professor in the Faculty of Medicine and the Department of Occupational Science and Occupational Therapy at the University of British Columbia, and the scientific co-director and co-lead of the Knowledge Mobilization Program with the Child Bright Network. Jessica Green is a patient partner with the Parent Voices Project of Child Bright. And Mei Liu is a staff pediatrician in the Division of General Pediatrics, a full professor in the Faculty of Medicine at Université de Montréal, and a clinical scientist with CHUS Saint-Justin Research Center. For more fulsome bios for this mini-series, moderator and guests, please visit childrenshealthcarecanada.ca. Welcome, Keiko. Thanks for moderating this important discussion. I'm passing the mic to you.
Thank you, Paula. Thank you for having us in this important series when we're talking about key issues and how we can take advantage of research that is being done in Canada to produce and transform our healthcare systems for all children. Today's conversation will focus on something that families often know. They know very well, they know deeply, but systems don't always recognize or are able to implement. Lived experience is expertise. And we'll talk about invisible labor, meaningful participation, belonging, implementation gaps, and what it really takes to create systems that work with families instead of simply around them. To have this conversation, we have here researchers and parents, a parent, talking about their experience in the Parents' Voice Project, one of the projects of the Child Bright Network that is trying to incorporate and integrate parents' voices, as the name of the project says, into the whole spectrum of care for children with different disabilities and developmental delays. And we're lucky to have the perspectives of a clinician, of occupational therapist who is also an implementation scientist, and a parent to provide insights and suggestions of how we can integrate that into systems-wide transformation. So to begin with, we will talk about how the system is currently in place, how it's currently structured. So, what do families often see about the systems, about the healthcare system, and while they're navigating it, that may remain visible for healthcare practitioners, that may remain visible for systems managers, and for other professionals that are working in the system?
I think from a family perspective, there's the healthcare system, and that is one of many systems in which the family is navigating, and that might be the invisible, one of the invisible pieces. They are navigating, and they're coordinating. They're noticing patterns. They're adapting environments. They're trying to create continuity between these systems that which are sometimes and more often than not fragmented. And so I think when working with a family, you're working with a mother, a father, a caregiver of some kind, a child, who's bringing that, not just that history, because it's something that is likely being lived in that moment. And so that's quite weighty. They're having to learn in all of those different systems, they're learning different languages. They're creating meaning from that, and then trying to translate it. And the cost of not doing so means that their child will suffer.
Thank you, Jessica. Yeah, and this is those are aspects that are often not seen, like what's happening on the backstage of families' lives, right? When they arrive at the systems, um, may not be seen or fully clear for the professionals that are dealing with the families when they arrive. Um, Anyone wants to add from the professional's perspective? Stephanie, what do you have to say?
I was going to share, I mean, as in my experience as a parent, also accessing services for my children, even though I'm in the pediatric system, depending on what services you're trying to access, you might not know where they are or what's available or that they even exist. And if it's that hard for someone who is already in the clinical system, that gets amplified for folks that are not. Um, One thing that I have seen families manage in this context is the impact of the system's gaps or its failings on the community. So whether that's something that the family feels itself or that um, they see in their own community, they see the impact of that, and clinicians may not see that. They might not recognize what impact that has for families or communities trying to work through and identify solutions to help their children.
Yeah, that's important, and that brings to the point of, so we see those gaps and we know they exist, and there is like a divide between what families are living and what the professionals or the people are experiencing. And another different sector is information, right? It seems that people don't know where to access information and how to know what is out there. And on this, what would be your suggestions, or what are you learning through parents' voices of how we can use this lived experience not only as like a testimonial or a personal perspective or something that a story that parents have to tell, but rather as through knowledge and through data that can be integrated into the care and into the flow of the system.
Yeah, I think this is what we've tried to achieve with the Parents' Voice project. We, in research or even in clinics, we think we know what parents want to know, but the truth is we probably never asked in a systematic way. So this was one of the goals of the Parents' Voice project. We had several phases, and in phase one, what we tried to figure out was, what do parents want to know? What do they want us to ask them as part of neonatal follow-up. So maybe just to give you context, this project takes place within the prematurity community. So across Canada, all children born extremely preterm are usually followed in a standardized way in specialized clinic. And we have protocols, we even measure outcomes for quality improvement. But the thing is, we never ask parents what really mattered to them. And when we asked, what's very interesting and may seem very obvious for families with lived or living experience is that our focus is a lot on diagnosis and we give information on diagnosis, the deficits, but we forget about the basic things like how is this going to impact my child in everyday life? How is my child going to function? Is my child going to be happy? And what can I do to make sure that even with some diagnosis that maybe doesn't mean very much to me, how can I make sure that my child is still functioning, has good quality of life, participate, have friends, etc. So this is like the main message we got from families from phase one, which was maybe we're not, I mean, we are interested in diagnosis, but you should move beyond just diagnosis and look at functioning, quality of life, child well-being, parents' well-being also, which are maybe like the invisible thing that we don't look at in clinical follow-up. And now, as part of our phase two implementation project, the challenge is how do we bring this to practice now? How do we change the paradigm in neonatal follow up where we look at diagnosis and now try to look beyond diagnosis and more functioning like the WHO model on functioning participation and
The
look at
ICF.
the child, yeah, the ICF model, and look at the child also like in the whole, bigger context, how is the family, what is the environment around. So how do we shift the paradigm from a deficit-based approach to something which is more strength-based and really take opportunities of the family strength to really, push the child as far as he or she can do. So it may seem obvious, but when you move to clinic, it's changing behavior, it's changing practice. So not that easy.
And that is, yeah, that is a good point that I would like to hear your perspectives. It's changing the paradigm is for the for not for the families but for the service providers, right? How can we do that? Like, how can we really shift from a systems perspective the current structure of services in a way that favors those types of outcomes that you're hearing from families? What are some suggestions? And I know that's not a simple question to answer, but that's what, if we're thinking of transforming systems that integrate, right, those parents' voices into the actual practice, what that would look like.
I can speak to that a bit. In our implementation science project, what one place we started was identifying the barriers and facilitators to implementing family important outcome measures in the neonatal follow-up clinics. And that gave us insight into what are some of the commonalities across the country, or across professions or across clinicians, and what are some things that might be unique to a specific context. And we can work with that information to then tailor the strategies that we're using. One thing that has been centered in our work is the parent's voice. So it's not just one parent saying this is important. There was so much work done in phase one to really understand a range of parents' perspectives and also the clinicians' perspectives. And we take that information, and as we're working through some of the common barriers that relate to logistics, how are we going to adjust our workflows? How are we going to manage inputting the information? How are we going to use it clinically? Centering the why is so important. Why are we doing this? This is because this is what families tell us that they need and want. And that is a motivation in itself, right? You want to do well for the families, you're there to serve them. And so, can we set things up in a way that maybe adapts the way that we're already doing things to augment it in a way that is more meaningful for families or hits the mark um, in a stronger way so that they feel heard and what is important to them is visibly centered in their interactions.
If you look at a family's history, at least again speaking from our perspective, when you have a child, you don't know that you're, when you don't know that you are going to be moving through this. Like what, okay, getting a diagnosis, what does that mean functionally? Okay, so that my child, so my family can participate. But I think it's also important to connect with, first, before all of that, it's a family, it's a child, and what do all families, what do all children want? And there's likely several wants in that, but something that might be taken for granted is that, and may not be articulated, is what I want for my son is for him to have a sense of agency. And the path to that, his path, born very early, has been different than some of his peers. And I would say that, like his peers, though, and like his peers' parents, we want to nurture an environment where all of our children develop that sense of agency, meaning that they can say that they matter, that they can do something, that they trust themselves. And I think possibly from a clinician side of things, with the diagnosis, they're looking at what the barriers are. And as a parent, I'm looking at how do we create, how do we remove those barriers? How do we create, but not just remove those barriers, and how do we create an environment where my child's friends all have that same access, that access to agency.
Yeah, this is fantastic, Jessica. And agency is something that is becoming quite central in this podcast series. It seems a lot of what we are trying to do, or we're trying to conceive in and imagine on a better, improved healthcare system, involves giving agency to people, to the users of the system. I also heard adapting, like paying attention on workflow and how the perspectives of the clinicians into this, how people that are on the front line of delivering those interventions, what that could look like for them too. And that's the beauty and the necessity of implementation science behind it, so that we know it's not just an idea, it is there are actual steps for implementation. um, but I wonder if for families and for systems managers listening to this, how do we know that we created a system that is good, that responds to those patient, I'm saying patient quote unquote, patient reported outcomes, but patient important outcomes and family centered outcomes? How would you know, for example, in the neonatal follow-up and other types of services, how do we know that it has indeed, that we are indeed addressing those needs? Are there measures, are there parameters, indicators that we could be paying attention to know that this is happening?
Yeah, this is a good question, and may sound easy to respond to in theory, but when you try to apply it, it's more complex when you try to do it on a national level. So obviously, what we would like to see is parents' satisfaction with care, with their healthcare experience, and there are measures to look at that. But then we have to balance with not burdening families with tons of questionnaires to determine whether what we are doing is the right thing. So what we've decided to do is so to address this point of how do we make sure that we listen to families, address their needs. We've looked into implementing what we call like patient-reported outcome measures. We've decided to call it family important outcome measure in our studies, which are parent-completed questionnaires that will really report on what family views as important. It's very often centered around functioning and child well-being. And we actually went through a lot of questionnaires to determine which one was the best fit for to introduce into clinic. Parents were involved in every steps as well as clinicians. And one of the well, we end up like choosing two questionnaires, and I will maybe just talk about one which is around centered around the F words that were developed by the McMaster team and Dr. Peter Rosenbaum. And the F word is once again inspired by the WHO ICF model. And when we look at the F words, what are those? It's fitness, functioning, uh, friends, families, fun, and future. And really, when you talk to families, these words mean a lot. And it really moves away from, focusing on the deficit, but what opportunities can we take? What can we do to really, enhance or support these F words? And this FIOM, or Family Important Outcome Measure, is really one thing that we're trying to introduce. It has open-ended questions. It also has like questions regarding parental concerns with, for example, how their child is moving, how their child is communicating, how their child is their child experiencing any pain? And we're hoping that with that, we're able to better address these issues. Now, how can we tell if we really did? I guess this is where we're trying to get some quick satisfaction survey from families. We're trying to implement at the same time to measure whether it's working or not. But what we're also measuring is trying to see whether clinicians, after they reviewed these parent-reported outcome measures, did they do anything else? For example, did they give more information? Did this prompt a referral that they had not thought about, and which families were hoping to have? So there are different ways to measure whether it's working or not. We're looking from the clinician's perspective and also the family perspective and experience. But as I said, it seems easy to do in theory, but I have to acknowledge that in practice it's a little bit more challenging.
Yeah, it is often the case, right? That things are always easier in paper. And that is actually a good point to follow up. And I don't know if it's for Jessica, perhaps, to so adding all those questions, because a challenge we see for families that I've heard from families, it's also when you are at the entry point. So when you just had your baby and you're now going home or to the neonatal follow-up clinic and whatnot, there is a lot that you have to manage. There's a lot of this invisible labor and stressors that we've heard. But adding then the pressure, quote unquote pressure, for families to then identify what's important for them at a time point where you are perhaps just overwhelmed with everything that is going on. Is that does that how is that perceived, sorry, by families? What is the added, is there an added labor in trying now to define how this outcomes align with your family perspective, with your reality, crossing this information? Is that a challenge or is that a relief?
Would be dependent on the family, and that might vary based on my experience. Having a bit of a lay of the land would be helpful. It's how I operate, and so for many years, and I'm sure there will be moments in the future to come, there's a feeling of just not knowing of how to orientate yourself. And so I think by developing those relationships with families, I found working as a parent partner, for instance, invaluable in terms of having a sense of what my role is as my son's mother and advocate, and also what it means to be my son's mother and advocate might look different than some of my peers. And so through those relationships, I'm learning from the clinicians that I'm working with. I'm learning from the educators that are working with my son. I'm learning from the researchers and the work that they are doing. So I think there's an evolution to that. And if there's a starting point, I think it would be to recognize that the family is embarking on into a different terrain than they might have expected. I think there's a lot in our world that is unconscious. There's the things that we assume, the things that we have been. It's part of our culture, right? Well, this is what happens at this stage of a child's life, or this is what happens when this life event happens. And when we no longer have that script to follow, we rely on guides. We rely on people with curious and compassionate minds, and people who are interested in forming relationships, and not just relationships that are short term, but they recognize that relationship, whether it's with that clinician or whether it's with that institution, is continuous and it grows.
Thank you, Jessica. Yeah. And on this aspect of the relational component, right, that goes with the systems of care, if we're caring for people in health or education, whatever the system we are, through the different supports that should be offered or should be given to people, it would be beautiful to have systems that reflect, as you say, in the relational aspect or understanding the humans involved in this relationship. But we know that many systems and services are structured around short-term interactions or one-point contact and not developmental relational consideration. So you see the client or patient, and then the person is off to the next thing, and there is no connection. So what are we learning in these projects with families and families interacting with systems? What are the perspectives that we are bringing that could suggest changes in the system towards a more relational continuity of care instead of a point-based perspective that we have now?
So in neonatal follow-up, I think what we've come to realize is the privilege that we have to be able to get this longitudinal journey with families, sometimes even starting from the NICU and then up until school age. That's the ideal world. And some programs have been able to achieve this by really accompanying the family from the NICU up until transition to school age. And I guess if you are to build this long-term relationship, it makes sense to not just focus on what the child cannot do and making diagnosis, but get first to know, okay, tell me about your family. Tell me what you do together to have fun. Like, and what does your child like? This really is at the basis of building a relationship. When you meet someone new, you're not going to ask, hey, like, can you walk or can you talk? When you're going to tell them like, hey, what do you like to do for, for fun? And tell me about your parents. Tell me about your children. Tell me about, the friends, your friends or your larger family. And this is actually like looking at what we're trying to implement, this family important outcome measures. It actually starts with those open-ended questions. And even if it's not parents who are necessarily like, you know, writing their answers, it also gives a template for clinicians to start a conversation. Maybe this is not how we were trained to open a conversation in a quick medical visit, but we're actually trying to influence people to change how they are initiating this conversation with family, going with what they feel is really important. And getting to know these elements is important because if we have a child who has challenges, it's good to know what are the strengths or what this family does to, to have fun, or once again, like looking at opportunities to really support this child and family. But to do that, you need to know who they are, what's their values, what they like, etc. But once again, this is not how we were trained in medical school. We were trained to ask, okay, what's the problem? And let's try to fix it. But the way we're trying to fix it may actually sometimes be harmful and create trauma or, negative emotions with families. This is at least what we have been told by the several families we've met and interviewed.
Right. So there are ways that we can support health outcomes or healthier outcomes if we treat and see health as a more complex, holistic perspective, right? We know, for example, the F words framework or the important words in childhood development come, came from the ICF, and it's used and adopted in the government of Ontario, for example, to understand or support benefits. Parents can use this as a resource to see what are the important outcomes. And that is an example of how that has been used for policy change or to inform the way that policy is built on. So, do you think that this type of framework could be uh, adopted, or could be the interactions with parents or the way that parents and families experience systems could inspire the way that families also relate to professionals and relate to the systems?
I can speak a little bit to that. I wanted to just raise the value of co-design when we sit down together and think about what we're going to do or what we're going to focus on or how we're going to achieve it. Having those voices at the table is so critical. You can have a researcher perspective or a clinician perspective or a parent perspective or some combination of those, but bringing more voices to the table means that you have different solutions that can be put forward. And I reflect on discussions with Jessica about continuity of care and the uncertainty that comes with what's next when I'm discharged from this clinic that provides this services, and I don't know what that's going to look like, and I need to find new caregiver or like new providers, and I don't know what to look for or I don't know what to ask. It's our role there to help prepare families for what that journey might look like, and to connect them to those um, the next group of people that will support them along the journey because of the way that our system is set up. And I think that the learning from this project does apply in those other sectors or other service types where if you're listening to families about what is most concerning to them or what they have questions about or what their priorities are, then we can work to integrate those things across sectors. And they might be different at different times, and we don't know unless we listen.
And that is fantastic. It seems that listening is really a key ingredient in this component, in this interaction. And that's a call for that, right? We need to be listening. Do you see, to wrap up as a last question, we had 10 more minutes, but let's go from another aspect of making interventions and systems more meaningful and connected. To the point that Jessica mentioned, um, how do we provide agency, right? Agency for families is an important outcome, but also agency for children, right? Bottom line, families are the ones that are most concerned about the well-being of their child and how they're going to be happy, how they're going to develop. And I remember seeing families like when they just get a diagnosis and feeling lost and wondering like, how is my child? I thought my child was going to do this and that, or go to this university and have this profession. And now I'm seeing everything so differently because I got this diagnosis. But there is a lifespan approach that gives agency, gives hope, that builds on what children need and how professionals are taught from the moment of diagnosis and throughout the different steps of the system, integrating and implementing families' voices across the service and across the different services and across the lifespan and in key transition points could help support children's agency by also understanding what they are capable of or how they communicate with professionals and with the system so that they get the best that they need to get through the different systems of care. So, do you expect that this transformation in systems to also reflect on child outcomes?
Immediately, what comes to mind is our children are learning from their environment, and their parent is, depending on what age and stage they're at, is in their immediate environment. So the parent's sense of agency is going to directly translate to the child's sense of agency. Something that's I've become aware of in my advocacy for my son across systems is that while I'm advocating for him to have certain services and certain opportunities, and times I wonder, oh, is this worth it? Because it's taking away from my parenting time with him. But then I also I balance that with the fact that he is watching me advocate. And so he is therefore also learning how to advocate for himself. And there was an example of that only a week or so ago. He was on a Zoom meeting with his SLP, and it was in the morning before he goes to school, so I'm in the background getting his lunch ready. And she asked him a question, and I don't remember what the question was, but he responded, my son is 9. He said, I know I've learned this before. I can't remember it right now. I need you to help me. And I thought to myself, I think he just advocated for himself. And at the end of the session with the SLP, I was speaking with her, and that was the first thing she mentioned. She said, do you notice he advocated for himself without apology, and without shame. And I realize he's learning to do that by watching me do that, by watching other people in his life do that, because he's learning what his rights are in that process. He's learning what his value is. He's learning that he belongs. And I remember once a friend told me, in order to become, we first must belong. And so the first place a child belongs is with their family. And then that grows into their community. And so the more empowered a parent is, the more empowered a family is, the more empowered a community is to support the child. That relationship is reciprocal. And so I don't know if we can separate them.
Thank you, Jessica. That's fantastic. I mean, the essence is that, right? That by transforming the systems, we can transform the way that families and children see themselves in the system. And we'll mirror that through the community. So there's a ripple effect there, hopefully. How we spread innovation in the healthcare system comes one relationship at a time. I think this is beautiful, beautiful lesson to take. And it's also a powerful one, right? Because it speaks to our ability to, if we can change those relationships by integrating parents' voices into it, we can also transform the ways that children see themselves and that communities see children and move towards a more integrated systems of care. Perhaps one wish that you would have for our systems to move in this direction. So if we could wrap up with what is your hopeful view for the future? What is that you would like to see happening? That we can close this podcast with.
I can start with that one. I guess what I find very encouraging is this, talking about relationship, this great relationship we have now as a follow-up research network and with the parent community, which we did not have 10 years ago. And this relationship is just building stronger. And I think together, there's a lot of projects we have on the table. There's a lot of hope to improve the system, not as separate entities, but together. So this is like really my hope. And this is built from actually what Childbright has brought to really work with, to do patient oriented research. Now, what my wish list is that there are, I think, more and more people converted in the research community and in the, I guess, the clinical community, but it hasn't spread yet as something which is so obvious. So my wish is that as we move forward, people understand that we cannot change systems just looking at it from the clinician or researcher's perspective. You need the families. They are actually the most important people in this transformation. But you need to change mentality. I think we still have doctors, physicians, leaders who think that, they don't need the input from the people with lived and living experience.
I'll maybe go next. I am seeing more and more researchers and especially trainees engaging in patient oriented research or partnered research. And uh, it's really heartening to see, and not because it's part of a funding application requirement, but because they see the value in that and they value um, like lived experience perspectives and what they can do to improve the way that we do research, the questions that we ask, and the outcomes that we get. My wish would be that our systems put more resources into adapting so that that is more integrated and, as Mai said, the starting point, right? It's that should be the given, and we work around that so that it's commonplace and there's always lived experience voices driving the way that the systems are shaped to meet their needs.
Regarding the first point, is I'm hopeful, when we have conversations like these, when people are making the time in their workday to highlight some of these difficulties. I feel like that's not the right word. To highlight what they're seeing and bringing that forward, bringing attention to that. I think bringing your attention to anything is the first step to being able to address it. And what I would like to see, I feel like this isn't kind of a novel idea, is I would like to see more of a recognition that the systems are fragmented, and that it is important to build continuity between these systems, so that families aren't having to do that, so that teachers aren't having to do that, so that clinicians aren't having to do that. I think it's an unnecessary use of energy. I think that energy can be placed elsewhere, and most importantly, that energy can be placed in and directed towards the wellness and well-being of the child.
Thank you so much, everyone. We hope that this conversation reminded us that systems are not an imaginary entity or an organization that is completely out of reach, right? This is systems are humans. Systems are composed by people like you and I, administrators, healthcare professionals, decision makers at different levels, and all these people involved, and the parents and the families, of course, that we serve. We can transform those systems with knowledge. We can also transform systems by listening, by keeping the important people at reach and providing agency to this group. we can create something that can promote belonging and promote changes that we want to see by changing the relationships first. Thank you, everyone. We hope this conversation inspired transformation, one relationship at a time, one parent voice at a time, and also towards thinking of systems of care that follow children where they are, where they need to be, and providing a comprehensive, transformative, supportive system at all stages. Thank you.
That's the end of our time together today. Thank you, Keiko, Stephanie, Jessica, and Mai, for sharing your time and expertise with us. Thanks again to our sponsors, the IWK Health Center and ChildBright, for their support. To stay up to date on all Spark offerings, including upcoming podcast episodes, please visit our website at childrenshealthcarecanada.ca and subscribe to the Spark News e-bulletin if you haven't already. And before we go, show some love for your Spark Conversations podcast by leaving us a review and joining us for the next mini-series. Bye for now.